So, in terms of the relevance of social data to drive evidence-based decision making, I think it is critical that we continue to develop, especially our administrative data sources. Administrative data sources are data that are generated in the operations, say, of the Ministry of Health, the Ministry of Education, in their operational work, right? So we need to continue to improve those. Those are important to the functioning of the various ministries and to the monitoring of their effectiveness. However, other social data, for example, like from data collected from surveys, are also extremely important. And they can all be harnessed into one indicator that allows you. I think one of the central messages is that they need to be better communicated, right? They are varied. They describe many different phenomena, whether it be unemployment, the educational status of people, literacy levels. They describe wealth. So they are varied and wide-ranging, okay? So sometimes it's a little difficult for our policymakers to put their hand around all of these things. Unlike the economic side where you have GDP. You know, the economy grew by 3%. And it's very clear, that communication mechanism. But on the other hand, what we need in the social sector is a manner of harnessing all of these indicators to make them much more effective communication tools for policymakers to communicate to the public, and for people who collect and disseminate data to communicate to the policymakers, right? Also as a tool for the management of policy implementation and activities, okay, that impact directly on people, right? So I think it's really important that not only the fact is that social data collection is important, but it needs to be harnessed and communicated more effectively to ensure that you have an ability, as you implement a program, to reduce poverty, to reduce unemployment. You have an objective and easily understandable means of knowing what the impact is and how far you can go with various policies. Right? And that is, I think, the crux of the matter in terms of ensuring that you have the ability to monitor the effectiveness of your programs, to pull back when it's not working, to push harder when it is working. This issue about multiple indicators of poverty, it's now called multidimensional poverty measurement or multidimensional poverty index. Traditionally, the approach to measurement of poverty have been that we look at how much people spend, and we decide if, based on how much they spend, they're wealthy enough to acquire the minimum amount of goods and services, right, for all of their family members. Okay, and if they don't attain a certain level of money, we say they are poor, right? If they attain more than that, we say they're not poor. All right. In fact, you get a lot of people who don't fit that money description of poverty, and that is the problem with that type of measurement. That's why you need to bring in many more aspects. You need to bring in the education aspect. You need to bring in the information, access to information, so they can be empowered to know what is good for their health. And all of that, you need to bring in also the money aspect, because that's a central and important aspect of their lives. There is also the health aspect. There's also children's aspects, right? Because when you have a situation where a household may not be poor, but the child is malnourished, it means that the parents are not minding the child well enough, and that household should be classified as being poor and deprived as a result of the condition of the children. Okay, so that there's this recognition that you had to look at more than just money. All right, and it is on that basis that many of the development partners have been looking at multidimensional poverty as a means of better explaining and communicating deprivations. Okay. And so now we have the possibility of looking at deprivations in a much more multifaceted way and have a much more effective method of communicating it in its various dimensions.